Good day to all. Thank you to the organizing committee for giving me this opportunity to present my work in the 21st MATCAS Annual Scientific Congress. Today, I'm going to present on the prevalence and impact of anemia in patients undergoing CABG. Anemia is a known risk factor for adverse outcomes following cardiac surgery. It is observed in several observational studies. However, the exact prevalence of anemia in patients scheduled for cardiac surgery has not yet been ascertained. It is especially common in the Asian populations. It remains controversial whether the impact of preoperative anemia on post-surgical outcomes is triggered by low hemoglobin level per se, or because of the comorbidities that frequently associated with anemia, such as heart failure, chronic kidney disease, or chronic diseases, or even because of blood transfusion itself. The objective of my study is to determine the prevalence and impact of preoperative anemia on clinical outcomes in patients undergoing CABG. This is a retrospective observational cohort study on patients underwent isolated CABG from January 2016 to December 2019 in 4 years periods. The data was collected from the IJN Adult Cardiothoracic Surgical Database. Important outcome data such as mortality was cross-checked with the monthly mortality census to watch for accuracy of the data. Logistic regressions method was performed to look for association of preoperative anemia and postoperative mortality and morbidities. Selections bias that are not controlled by the multivariable methods was assessed with the propensity adjusted method. In this 4 years period, there were a total of 6,054 patients underwent isolated CABG in our center IJN. 34.3% of the patients indeed had preoperative anemia according to the WHO definitions of anemia, where it is defined as HB less than 12 gram per deciliter for women and less than 13 gram per deciliter for men. This table represents the baseline characteristics of the patient's populations. As you can see, the anemic patients tend to be older, twice likely to be female compared to the non-anemic group, and they have a lower BMI, higher prevalence of diabetes mellitus. Chronic kidney disease defined as eGFR less than 50. Anemic patients tend to have a higher prevalence of being chronic kidney disease, end-stage renal failure, and anemic group patients tend to have poorer ejection fractions and a higher Euro score 2 in the high risk and very high risk group. On clinical outcomes, the overall mortalities were 3.7%. Anemic patients had a higher mortality, which is 6.1% versus 2.5%. The overall blood transfusion rate in our center was rather high, which is 57.6%. Anemic patients have a higher blood transfusion rate compared to the non-anemic group, which is 77% versus 48%. Anemic patients had a higher rate of post-operative hemodialysis, which is 5.1% versus 1.2%. Post-operative AKI was classified according to the Rifles criteria. Anemic patients are twice likely to develop post-operative AKI compared to the non-anemic group. Chest reopen rate was higher in the anemic group, which is 6.8% versus 3.7%. There were higher deep sternal wound infection rate in the anemic group, which is 0.7% versus 0.3%. Anemic patients have a longer ICU stay more than 48 hours, which is 53.8% versus 41.5%. Post-operative stroke was not significantly different. Multivariable logistic regression analysis showed that Preoperative anemia is an independent risk factor for postoperative mortality and morbidities, where you can see the Creutz's odds ratio for mortality is 2.2, postoperative dialysis is 5.4, higher blood transfusion rate odds ratio of 3.5, postoperative AKI odds ratio of 2.3, and ICU length of stay more than 48 hours is 1.5. Selection bias that was not controlled by multivariable methods was further assessed with a propensity adjustment analysis. Adjusted odds ratio still show that preoperative anemia is still an independent risk factor for postoperative mortality and morbidities. Preoperative anemia is indeed common. It is present in a third of the patients undergoing CABG in our center. Anemic patients have a higher risk profile as evident by their being older, have higher proportions of being female, more comorbidities. All this has contributed to the higher Euroscore too. Propensity-adjusted multivariable analysis demonstrated that preoperative anemia is an independent risk factor for increased blood transfusion rate and higher postoperative mortality and morbidities. There are several limitations in this study. This study population only include isolated CABG. Patients presented for valve, aortic, or combined surgery were excluded. They might have some incomplete data from the database set. And also, this is a retrospective analysis. I was unable to account for the influence of any residual unmeasured factors that could affect the adverse outcomes. And importantly, it did not take into account specific details on the intraoperative and postoperative management. In particular, information regarding the minimum hematocrit level during the cardiopulmonary bypass, postoperative blood loss, and amount of blood product usage. In conclusion, preoperative anemia is indeed common in cardiac surgical patients. I have demonstrated that anemia is an independent risk factor for increased postoperative mortality and morbidities. Preoperative hemoglobin level should be incorporated into the risk calculation model. I hope this study can raise the awareness among the clinician to look out for preoperative anemia, and all the anemic patients must be thoroughly investigated to identify correctable causes and has their anemia treated before being subject to surgery as time permits. With that, I thank you all for the kind attention.